Welcome to Exciting Historian. Imagine this. Over 1,300 years ago, in the vibrant heart of Damascus, a revolution in healthcare quietly unfolded. Around 707 AD, during the reign of Caliph Al-Walid I, one of the world's first public hospitals opened its doors, not just to the rich or powerful, but to everyone in need. Known as a Bimaristan, this early hospital became more than just a place for the ill. It was a symbol of compassion, progress, and scientific inquiry. Built on principles of equal access and care, it inspired generations of medical institutions across the Islamic world. And centuries later, its influence reached Europe, helping shape the modern hospital system we know today. The year is 707 AD. The Umayyad Caliphate dominates vast territories stretching from the Iberian Peninsula in the west to the borders of India in the east. Damascus, the Caliphate's glittering capital, stands at the crossroads of empires and ideas. It's not just a political center. It's a thriving metropolis of art, architecture, science, and education. Under the reign of Caliph Al-Walid I, the city flourishes like never before. Al-Walid is not only a leader of armies, but also a visionary builder. He commissions grand mosques, extensive roads, and, most notably, a revolutionary institution, a public hospital. This facility, open to rich and poor alike, signals a bold new chapter in healthcare and civic responsibility, rooted in innovation and deeply humanitarian values. The term Bimaristan comes from Persian, meaning house of the sick. But these weren't merely shelters or primitive infirmaries. They were organized, carefully managed centers of medical practice. In a Bimaristan, patients received diagnoses and treatments from trained physicians. They could be quarantined during outbreaks, observed clinically, and even counseled mentally. These hospitals often housed libraries for studying medicine, pharmacies for dispensing prescriptions, and lecture halls for training future doctors. In essence, they were universities of healing. The very idea that healthcare should be systematic, accessible, and grounded in learning, rather than charity alone, was revolutionary. Bimaristans redefined medicine as a public good and planted the seeds for medical professionalism. In Islamic tradition, caring for the sick is more than a civic duty. It's a divine responsibility. The Prophet Muhammad is quoted as saying, "For every disease, Allah has created a cure." This powerful idea inspired Muslim rulers to support medical advancement as a religious and moral obligation. Hospitals were often funded through waqf, charitable endowments, and physicians were expected to serve all people, regardless of faith, ethnicity, or wealth. Many Bimaristans even featured separate wards for men and women for different diseases and, crucially, for mental illness, treated with both compassion and scientific methods. These hospitals were not places of isolation, but of dignity and recovery. Faith did not hinder medical progress, it accelerated it. Science and spirituality were seen not as opposites, but as partners in healing. As the Islamic Empire expanded westward and eastward, so too did the model of the Bimaristan. Great cities like Baghdad, Cairo, and Cordoba built their own advanced hospitals, modeled after the one in Damascus. These were not isolated institutions. They became beacons of public health, attracting scholars and physicians from across the world. Through trade, travel, and especially the Crusades, Europeans came into contact with these sophisticated systems of care. They took note of their cleanliness, structure, and organization, and began adapting similar models in medieval Europe. Techniques like quarantine, detailed patient records, and specialized surgical tools found their way into Western medical thought. The legacy of the Islamic hospital stretched far beyond its walls, laying the foundation for Renaissance-era medicine and eventually the global standards we depend on today. Modern hospitals, with their structured wards, dedicated staff, pharmacies, and universal access, owe a deep debt to the Bimaristan. These institutions introduce concepts we now consider fundamental: the value of clinical observation, the necessity of ethical medical practice, and the principle that treatment should be based on need, not wealth. While today's healthcare systems are more technologically advanced, many still struggle with the same questions faced in 707 AD. Who deserves care? How do we ensure compassion alongside competence? Looking back at the Bimaristan reminds us that medicine is not just about innovation, it is about human dignity. Remembering this legacy encourages us to create systems that heal both the body and the soul, echoing the principles laid down in Damascus over a millennium ago. So, what surprised you the most about the world's first Islamic hospital? Was it the inclusive care, the scientific structure, or the harmony between faith and medicine? More importantly, do you think today's healthcare systems reflect that ancient vision of access, compassion, and ethics? Drop your thoughts in the comments. We'd love to hear from you. Want to support my work? Join me on Patreon, buy me a coffee, or Ko-Fi to help keep these stories coming. What do you think was the most important event in 707 AD? Let's keep exploring the stories that shaped our world and keep the legacy of healing alive, one story at a time.